trochanter in the context of measuring trunk rotation. The greater trochanter is this most lateral part of the femur, and we find that by internally and externally rotating the hip. We can either do that with the knee bent and then swinging that lower leg, okay? Or if the leg is straight, we can do it by rotating the entire leg. The trochanteric bursa is going to be immediately on top of that. Again, you're not going to be able to palpate the bursa unless it's swollen, okay? Talking about palpating the upper border, you're just going to find the most lateral portion and then come superior, okay? So then, we've also already talked about the inguinal ligament, which is going across here. Now, just below that, we're going to have nerve, artery, and vein that are going to be just below that in the femoral triangle. And we want to be able to palpate the femoral pulse right there. There are also going to be lymph nodes just inferior to the inguinal ligament. Okay, so I want you to palpate for those as well. What's next? Okay, and then muscles. So if I can have a volunteer, I will go through all of those. So I need somebody on the table. Supine. Thank you, Maddie. You've got a really super big pillow.
Oh, great.
All right. So starting out with the greater trochanter. So I'm going to just, and again, the mistake that we see most often is people poke like this to try to find the greater trochanter, and it's far too easy to miss. I want your seat. Get all relaxed. What you want to do is put your entire hand on the side of the hip and then press in, and you can feel the bone, so it's going to be right here. A lot of people, it's a lot lower than you expect it to be, okay? And then I'm going to have you just rotate your leg in and out. Okay? And go ahead and relax. So I'm on the greater trochanter. If her bursa was swollen, I would be able to feel that here. And then what I'm going to do is feel along the upper border of the greater trochanter. Okay? Now the other one was the pulse, and if someone's hip flexors are tight, having them lie flat isn't super comfortable, and it makes all the tissues tighter. Is there one in the back? Yeah. Of course I don't work right there. There you go. So this just puts a little bit of slack on the inguinal ligament in the anterior hip. So ASIS, I'm going to come medial, and I'm going to find there's the inguinal ligament. And now I'm going to feel for a pulse. I tend to start medially and then work laterally, and so there's her femoral artery, okay, on this hand, right? But do you see that I'm not like this or like this? My hands are still pretty flat, and they're just at a slight angle, okay? Now for the lymph nodes, again, that's going to be those grains of rice. Aren't you the one that has swollen lymph nodes?
Here.
Up here,
Yeah.
okay. I was thinking you had them down here too.
No.
Well, the good news is I don't feel any down
That's
here.
great.
So. Okay, so you're going to feel for the inguinal lymph nodes there. All right, Maddie, I'm going to have you roll over onto your stomach for me, please. All right, now, are you comfortable with your head like that? Or?
Yeah.
Okay.
That's how I sleep.
Can I just lay down just so your feet are hanging off the edge for me? There you go, thanks. I'm going to go ahead and step around so you can see a little bit better, which means you guys won't be able to, sorry. We talked about the piriformis is a really important muscle to be able to palpate because it crosses right over the sciatic notch, and so it can be the culprit. Sometimes the sciatic nerve can actually run right through the piriformis muscle as it exits the pelvis, and so being able to palpate the piriformis is a really important muscle. We also are going to have our glute max that's going to be superficial to that, and we need to be able to palpate that too. So what you'll notice is I've got piriformis running this way and the gluteus maximus running this way. So what we can do is change the depth of our hand and change the angle that we're palpating to be able to get to those two different muscles. So for piriformis, I'm going to find the the angle of the sacrum. Go over, and it also attaches to the greater trochanter. Okay, so I can go midway so that I'm mid-belly. And then what I'm going to do is that's going to be deeper of the muscles, so I'm going to go pretty perpendicular. And now I'm going to palpate, and I'm going to go cross fiber. Okay, now is the piriformis an internal or external rotator? It's an external rotator, so what direction do I need to go if I want to lengthen it? Internal, good. So internal rotation is going to be with the foot out. And so if I'm on the piriformis and I lengthen it, I should feel it get tight under my fingers. So this is a way to test to make sure you're on the piriformis. Okay? Now for the glute max, where we have those fibers that are running fairly in parallel with the spine, we're going to run this way. We're going to stay superficial, and we're going to go cross fiber this way. Now if I was too deep, I would be in line with those piriformis fibers. Okay, so it would feel different. Now for this one, to make sure that I'm on it, I could ask Maddie, can you just lift up your left leg up off the table a little? There you go, and back down. And I should feel that muscle contract under my hand. Okay, and that shouldn't cause the piriformis to contract. So it's important to practice that layer palpation to palpate glute max versus piriformis. Oh, and then so max is going to be most posterior, then med, then min. So you want to be able to follow that iliac crest and go. So there's iliac crest. I'm going to come just inferior to it, and that's where the glute muscles are attaching, is just along that rim. Okay? What's next? Anything? Okay, we already did psoas on the pelvis.
I don't think we did.
We did. Go ahead and flip over for me. Once I show you, you'll go, oh, yeah.
You might have palpated it as the iliac fossa, but psoas iliac.
Oh.
Yeah.
Oh. Good luck with that one. Yeah. So that's the one where you're coming in and going over the ASIS and going deeper. Okay, and that's to palpate the psoas muscle that lies in the iliac fossa. Sartorius, you're going to love the manual muscle test for that one if you like the weird high five. So this is going to be the frog leg. But so the sartorius is one that's going to cross over the leg, and it's that strap muscle, and it connects to the ASIS. What was that?
It's my favorite muscle.
The sartorius?
I feel that.
I'm a super spinatus myself, so that was my muscle in PT school. So here you're going to come just inferior to the ASIS, and then you can follow that sartorius muscle. That's the only one that should be a bit tricky to palpate. Yeah. Okay, do we have any more palpations, or is that it?
TFL and hip abductors.
Other than that's it, yeah. So TFL, what is the distal attachment for the tensor fasciae lata? The IT band, okay? So we're going to find the body of the TFL anterior to the glute min, okay? So it's going to be a pretty lateral muscle, and the belly of it is going to be proximal to the greater trochanter. So you can go ahead and relax, whatever is most comfortable for your legs. Are you okay that way? Okay. So there's greater trochanter, so I'm going to go superior to it and lateral, and I'm on that TFL. Now the TFL is a hip flexor and medial rotator, so I can have her rotate, Maddie, rotate your leg in like that. There you go. And just doing that, I can feel the muscle contract, but then go ahead and lift your leg up for me. Good. And relax. So that's the way I can make sure that I'm on it. Okay? Adductors, usually you just palpate mid-belly. It's a group test, so you can just be palpating. If you want to make sure that you're on them, which it's hard to not be, just apply resistance to the inside of the ankle, and you can feel the muscles contract. Okay? So I wasn't trying to avoid them, but these are pretty easy ones. Okay? All right, so let's go ahead and palpate.